My name is Dr. Joshua Jones. I'm an orthodontic specialist here at my practice, Jones Orthodontics. Well, orthodontics is actually what got me interested in dentistry in the first place. I went to my own doctor and I talked to him about it when I was getting ready to enter college, and he said, don't do it. Don't do it. It's not the same. So I was like, really? My own doctor's telling me not to be a doctor. So I happened to have an appointment with my dentist the next week, and I talked to him, and he's, oh, it's great. You know, it's just a great field to be in. And I'm like, okay. And I always knew that I enjoyed going to my orthodontist. And so I said, okay, well then I'm gonna look into this. I heard about ClearCorrect from an ad in one of our publications, and I had it sitting on my desk because it was something I wanted to look into because I was previously using another aligner system, and I wasn't really totally happy with it. And it just so happened that one day I had a really bad experience with the other aligners, and I just went right back to the desk. I flipped open the ad, and I made the phone call to get on board, right then and there, and I haven't looked back since. ClearCorrect stands behind its product. I can call, I can get a human on the phone when I call, and I can get questions answered. I can get things fixed. So I would say customer service is the #1 thing I like the most. And of course, it moves teeth. If it didn't move teeth well, I wouldn't use it. So I get good outcomes with less hassle. And of course, a lower price, which is, I can pass that along to my patients. So it removes the barrier for my patients to get treatment because they can afford it. It's more orthodontist friendly because instead of getting a box with all the aligners up front, you get the aligners in phases, so you get 4 at a time. So if you need to make any changes, then all you got to do is give them a call or shoot them an email, and you can make adjustments on the fly as you go. I use the models all the time to make replacement aligners, and that's probably the second biggest benefit to using the ClearCorrect system, is that I don't have to order an aligner if a patient loses or breaks it. All I have to do is go pull their box out, and I can remake it immediately within 10 minutes. It keeps the cost down because we don't have to pay for shipping and order it. I can just make it right there. What's nice about the Phase 0 is that they're not quite as quick to reject an impression. So we will get that passive aligner in to try it in. And if it's fitting just perfect, then we know we can go ahead and continue. If there's going to be any problem, we can pick it up there before we've actually delivered 4 or 5 aligners and gotten that far into it. You could basically do all the same movements that you would do with traditional braces. You could do the same movements with aligners. Sometimes you just have to be careful not to move too fast, but basically you could do, say, tipping, torquing, rotations. In fact, I find that torquing is, it's easy with aligners. With braces, sometimes you have to add extra bends in the wire, make sure you use high torque brackets, invert brackets. Whereas with aligners, they can put pressure in several different spots on the tooth at the same time and make sure that we're effectively getting that torque in really the same or shorter period of time. One of the trickiest cases I had was a patient who was severely crowded on the lower. She had over-retained primary cuspids that needed to go, and they were pretty large, so it really almost was like a normal extraction case. The way I treated it instead was I started off with just an Essex on the top, just to hold everything. Lower, I constructed a lingual arch. We had the teeth taken out, and we used just a couple of buttons to retract the teeth. Pretty much just tipped them back into the space, and then we went ahead and took the impressions and started the ClearCorrect. And so far it's going great. The teeth are uprighting, and that was one case where I thought a little outside the box, and ClearCorrect made it easy. I would say we do more aligner cases now than we did before, and I think the biggest reason is cost. Because the cost of ClearCorrect is lower, I can pass that savings along to my patients. So I would say we do a few more cases than we did previously, but I can say that we've saved money on it because I haven't had to order replacement aligners. Even before, when I had to do that with the other competitor, and I had to pass that along to the patient. I hated to do it, and I usually wouldn't pass on mid-course correction fees except for the lab fees. So, I would lose money every time I took an impression because the impression material is expensive. But with ClearCorrect, I have less of those, less mid-course corrections, less initial retakes now that the Phase 0 is out. So, in that aspect, I save a little money on materials. I have recommended ClearCorrect to colleagues of mine who've had similar experiences to me with other aligners in the past. So I'm like, oh, really? Well, you want to solve all your problems? Here you go. And here's a phone number, call them up. So I would definitely recommend it to colleagues. Friends and family, sure. You know, I would treat all my patients the same, like they're part of my family. So same thing I would recommend for, you know, just any patient. I would definitely recommend to my friends and family. I don't sell anything because last thing I want to be is a salesman. I want to be a clinician. I want to treat them. So I always give the patients all the options that will work for them, and I'll leave it up to them. So aligners kind of sell themselves, really. Patients come in, everybody wants them. You know, who wouldn't? They're clear. You can take them out. You know, so yeah, I let them pretty much sell themselves. And you know, once we explain to them the cost. And that it's really not too much more than braces, you know, patients, they'll just jump right on it if that's what they want.